Today, we are talking about a crucial topic for our well-being: blood circulation. If you've ever wondered how to improve your cardiovascular health and feel more energetic, then this video is for you. In today's video, I reveal 3 amazing vitamins that can work real magic for your circulation. Not only do they help keep your blood flowing and your heart healthy, but they also have immediate and powerful effects that you can feel right away. Get ready to discover often overlooked secrets that can really improve your daily life. We will explore how these vitamins work and why they are so crucial to your circulatory system. Don't miss your chance to find out what they are and how to incorporate them into your daily routine for visible and lasting results. Stay with us until the end for a complete overview and some practical tips on how to get the most out of these vitamins. So if you're ready to feel your best, subscribe to the channel, activate the bell, and get comfortable for this journey to optimal health. Let's get started right away. Let's start with the first vitamin on our list, vitamin B3, better known as niacin. It is one of the most versatile and important vitamins for our health, but it is often overlooked compared to other more famous ones, such as vitamin C or D. Niacin is a powerful natural vasodilator, which means it helps dilate blood vessels and improve blood flow, especially in areas of the body furthest from the heart, such as the legs and feet. This is essential for preventing problems such as varicose veins and chronic venous insufficiency. How underrated do you think niacin is compared to other more famous vitamins? Let me know in the comments. In addition, niacin is known for its positive effect on cholesterol. It helps reduce levels of LDL cholesterol, the so-called bad cholesterol, and increase levels of HDL cholesterol, the good cholesterol. This action is crucial not only for heart health, but also for keeping blood vessels free of obstruction, facilitating unimpeded and continuous blood flow. High cholesterol can lead to plaque buildup in the arteries, a problem that can narrow blood vessels and restrict circulation. Niacin, therefore, plays a preventive role against atherosclerosis, a major cause of circulatory problems and cardiovascular disease. Niacin in the prevention of circulatory disorders. The importance of niacin in the prevention of circulatory disorders cannot be underestimated. Clinical studies have shown that niacin may be useful in the treatment of intermittent claudication, a condition characterized by pain and cramping in the legs due to inadequate blood circulation. The use of niacin supplements in these cases showed significant improvements in the distance traveled by patients without pain, indicating improved blood flow. In addition, niacin is often used as part of therapy for patients with peripheral vascular disease, PVD. These conditions, which include atherosclerosis and other diseases related to narrowing of the arteries, can drastically reduce circulation in the lower extremities. Niacin's ability to dilate blood vessels and improve the blood lipid profile makes it a promising therapeutic option for improving blood flow and reducing symptoms associated with these diseases. In addition, niacin has anti-inflammatory properties that may help reduce inflammation in blood vessels, further improving blood flow. Food sources of niacin. To get the benefits of niacin, it is essential to incorporate it into your diet. According to the National Institutes of Health, men should aim for an intake of 16 milligrams per day, while women should aim for 14 milligrams. Niacin can be found in a wide range of foods, making it relatively easy to meet daily requirements. Common sources of niacin include chicken, tuna, turkey, beef, peanuts, lentils, and avocados. Whole grains and green leafy vegetables also contain significant amounts of niacin, making it accessible to those on a vegetarian or vegan diet. As you have seen, vitamin B3 or niacin is a vital nutrient for improving blood circulation and supporting overall cardiovascular health in addition to functioning as a natural vasodilator. Vitamin B6, a crucial nutrient for circulatory and blood vessel health. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that plays a key role in a wide range of bodily functions, including blood circulation. This vitamin is often underestimated, but its importance for general well-being, cardiovascular health, and blood vessel maintenance is immense. Vitamin B6 is essential for more than 100 enzymatic reactions in our bodies, many of which are directly related to the cardiovascular system. Role of vitamin B6 in hemoglobin production. One of the most significant roles of vitamin B6 is its involvement in the production of hemoglobin. Hemoglobin is a protein in red blood cells that is responsible for transporting oxygen from the lungs to all parts of the body, including extremities such as the legs and feet. Good hemoglobin production is vital to ensure efficient blood flow and adequate tissue oxygenation. Vitamin B6 and the regulation of homocysteine. Another crucial role of vitamin B6 concerns the regulation of homocysteine levels in the blood. Homocysteine is an amino acid that, if present in excessive amounts, can be harmful to blood vessels. High homocysteine levels are associated with an increased risk of atherosclerosis, a condition in which arteries become thick and stiff due to plaque buildup, restricting blood flow. Vitamin B6, along with other B vitamins such as B9, folate, and B12, helps convert homocysteine into other substances that the body can use, reducing the risk of blood vessel damage and improving overall cardiovascular health. Effects of vitamin B6 on heart and blood vessel health. Blood vessel health is crucial for an efficient circulatory system. Vitamin B6 plays an important role in the prevention of cardiovascular disease through its ability to keep blood vessels healthy and free of obstruction. Studies have shown that adequate levels of vitamin B6 can reduce inflammation within blood vessel walls, decreasing the risk of developing conditions such as myocardial infarction, stroke, and heart failure. Reducing inflammation helps improve blood vessel dilation, thereby facilitating better blood flow. Recommended dosage and sources of vitamin B6. Adults should consume about 1.3 milligrams of vitamin B6 daily, according to the National Institutes of Health. However, requirements may vary depending on age, gender, and individual health conditions. Pregnant women, for example, may need more to support fetal development. Vitamin B6 is found in a variety of foods, making it relatively easy to meet daily requirements through the diet. Food sources rich in vitamin B6 include chicken, fish, such as tuna and salmon, potatoes, bananas, chickpeas, nuts, seeds, and whole grains. Including a variety of these foods in the diet can help maintain optimal levels of vitamin B6, supporting blood circulation and overall health. Potential side effects of excess vitamin B6. Although it is important to ensure that you are getting sufficient amounts of vitamin B6, it is equally crucial to avoid excessive consumption. High dosages of vitamin B6, especially when taken in supplement form, can lead to side effects such as sensory neuropathy, a nervous system disorder that can cause pain, numbness, and tingling in the extremities. Therefore, it is always advisable to consult a physician before starting any supplement regimen. Vitamin B6 in the prevention of vascular disease. In addition to reducing homocysteine levels and supporting hemoglobin production, vitamin B6 may also have a preventive role in the management of vascular disease. Studies suggest that adequate intake of vitamin B6 may help prevent thromboembolism, a condition in which blood clots form in blood vessels and can lead to serious complications such as pulmonary embolism or stroke. Vitamin B6 supplementation in combination with other B vitamins has been shown to be effective in improving vascular health and reducing the risk of cardiovascular events. Has this been helpful so far? Then leave a like to support the channel and subscribe so you don't miss out on more practical tips like these. Let's get to the third vitamin that can make a big difference in your circulatory health. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a crucial role in our body's health, particularly in red blood cell production and central nervous system maintenance. Although its reputation is often associated with the prevention of anemia, vitamin B12 is also critically important for good blood circulation and overall blood vessel health. A vitamin B12 deficiency can lead to several conditions that affect blood flow, blood quality, and proper functioning of the cardiovascular system. Role of vitamin B12 in red blood cell production. One of the main roles of vitamin B12 is to participate in the production of red blood cells in the bone marrow. Red blood cells are responsible for transporting oxygen from the lungs to all parts of the body, including extremities such as the hands and feet. A vitamin B12 deficiency can lead to the production of larger than normal red blood cells and a reduced ability to transport oxygen, a condition known as megaloblastic anemia. Megaloblastic anemia not only reduces the blood's ability to carry oxygen, but can also cause fatigue, weakness, and pallor, hallmarks of poor blood circulation. Good blood circulation is vital to maintaining optimal function of all organs in the body, including the brain and heart, and vitamin B12 is critical to support this process. Vitamin B12 and nervous system health. Vitamin B12 is also crucial for nervous system health. The nervous system and blood circulation are closely interconnected. Nerves control vascular tone and blood vessel contraction, which means that a healthy nervous system is essential for good blood circulation regulation. In addition, a vitamin B12 deficiency can cause nerve damage, impairing the body's ability to properly regulate blood flow, potentially affecting blood pressure and cardiovascular health. Neurological disorders resulting from a vitamin B12 deficiency can lead to symptoms such as numbness and tingling in the hands and feet, which are signs of poor circulation. These symptoms can worsen if the deficiency is left untreated, causing irreversible nerve damage and further worsening circulatory health. Therefore, adequate intake of vitamin B12 is essential not only to maintain the health of the nervous system, but also to ensure efficient blood circulation. Vitamin B12 and the prevention of cardiovascular disease. Due to its ability to lower homocysteine levels and prevent megaloblastic anemia, vitamin B12 is considered an important factor in the prevention of cardiovascular disease. Epidemiological studies have shown that people with adequate levels of vitamin B12 have a reduced risk of developing conditions such as atherosclerosis, hypertension, and other heart diseases. Maintaining sufficient levels of B12 in the body can help protect the heart and blood vessels from chronic damage, thereby improving longevity and quality of life. Food sources of vitamin B12 and supplementation tips. Vitamin B12 occurs naturally in foods of animal origin, including meat, fish, poultry, eggs, and dairy products. Especially rich sources include beef liver, mussels, clams, salmon, sardines, and lean beef. For people on a vegetarian or vegan diet, vitamin B12 can be obtained from fortified foods such as breakfast cereals, fortified plant milk, and dietary supplements. It is important to note that vitamin B12 is not found in significant amounts in plant-based foods, making supplementation essential for those on diets free of animal products. The daily requirement for vitamin B12 for most adults is about 2.4 micrograms, according to dietary guidelines. However, this requirement may increase for pregnant and lactating women. The elderly, in particular, are more at risk for B12 deficiency due to age-related decreased intestinal absorption. In these cases, vitamin B12 supplements or injections may be recommended to prevent deficiencies and their adverse health effects. Implications of vitamin B12 for circulatory conditions. Good blood circulation is essential for the transport of oxygen and nutrients to all cells of the body and for the elimination of toxins. A vitamin B12 deficiency can impair this process, with significant implications for overall health. For example, peripheral vascular disease, a condition in which the arteries supplying blood to the legs and feet narrow or become blocked, can be adversely affected by low B12 levels. Increased homocysteine and reduced production of effective red blood cells can worsen the situation, restricting blood flow and contributing to symptoms such as leg pain, intermittent claudication, and ulcers. Microcirculation health, which affects small blood vessels and capillaries, is also affected by vitamin B12. Efficient microcirculation is critical for healthy skin, wound healing, and proper organ function. A vitamin B12 deficiency can hinder microcirculation, slowing wound healing and increasing the risk of infection. In conclusion, B vitamins, particularly B3, B6, and B12 are key allies in keeping your heart, blood vessels, and blood flow at their best. If you want to improve your circulatory health, be sure to include them in your diet through foods such as chicken, fish, whole grains, and green leafy vegetables. Remember that although these vitamins can be easily obtained through diet, it is always a good idea to consult a doctor before starting with supplements.